Breast cancer is the most common cancer in women in Korea. Most breast cancers are found in women in their 40s or older, and the incidence rises with age. Breast cancer stage ranging from 1 to 4 is determined based on the tumor size and metastasis, and the course of treatment is planned according to the stage. For breast cancer patients who had a mastectomy, often feel a sense of loss and depression. In addition to such psychological issues, unilateral mastectomy can affect balance and cause postural changes and even lower back pain. This is why patients opt for breast reconstruction. Breast reconstruction is essential surgery that helps patients maintain their mental health and balance during treatment and recovery after mastectomy, and return to their normal lives after beating cancer. There are 2 ways to perform breast reconstruction: breast reconstruction using autologous tissue, and breast reconstruction using implants. Breast reconstruction may be performed simultaneously with mastectomy, which is performed to remove the tumor, or it may be scheduled after mastectomy according to the patient's wishes. For both partial mastectomy and total mastectomy, breast reconstruction can help add the necessary tissue. And if the nipple was removed along with the breast, nipple reconstruction can also be performed. Autologous breast reconstruction is most commonly performed by using the skin and subcutaneous fat from the lower abdomen or the latissimus dorsi muscle and skin from the back. The method of using tissue from the lower abdomen can be further subdivided. I personally leave the rectus abdominis muscle intact and remove just the blood vessels through free perforator flap surgery. This is the most difficult type of breast reconstruction surgery. The arteries and veins from the removed tissue are connected to the blood vessels in the breast. This is called microvascular anastomosis, which is a highly difficult procedure where 2 millimeters thick blood vessels are connected together. This procedure is essential because even the tiniest blood vessels must be connected perfectly to ensure graft survival. At Seoul St. Mary's Hospital, this surgery is performed with a general surgeon to drastically reduce the operative duration, and our success rate has been high. Autologous breast reconstruction results in nice texture and shape and minimal side effects. I first recommend using tissue from the lower abdomen. If that can't be used or the woman has small breast and is thin, I recommend using the latissimus dorsi flap. If the patient does not want any additional scarring, I use a tissue expander and an implant instead. The reconstruction method is determined after an in-depth discussion with the patient regarding the available surgical methods, as well as her body type and preferences. The breast must be reconstructed to a size that suits her body shape to ensure high satisfaction. If it is difficult to use autologous tissue because the patient doesn't have sufficient tissue in the abdomen and back, or the patient doesn't want any scars in the areas of her body, breast reconstruction can be performed by using a tissue expander and an implant. Breast implant reconstruction is simpler than autologous reconstruction, and it doesn't lead to any scarring in other areas of the body. So, it is chosen by around 70% of the patients. However, breast implants are not permanent and they are considered foreign by the body. So, it's true that there is a chance that there will be problems. Patients who have received breast implant reconstruction may need to replace their implants more than once in their lifetimes. What are the types of breast reconstruction surgery? There are immediate breast reconstruction, which is performed at the same time as mastectomy, and delayed breast reconstruction, which is performed sometime after mastectomy. Unless there is a high chance of recurrence of breast cancer, all patients are recommended immediate breast reconstruction. There are no differences between the two in terms of chance of recurrence or detection rate, and immediate breast reconstruction alleviates the mental distress from losing one's breast. Plus, the aesthetic result is better than delayed reconstruction. Does breast reconstruction increase the chance of recurrence? Some patients worry that breast reconstruction will cause recurrence of breast cancer. But there is no scientific basis to believe that. Some patients are also concerned that the breast reconstruction will make detection difficult in case of recurrence. However, diagnostic medical imaging equipment is very advanced, so recurrence is not difficult to detect. So, as long as you underwent surgery after sufficient consultation with a general surgeon and plastic surgeon, you have nothing to worry about. Dr. O is a leading authority in breast reconstruction who helps women maintain their self-esteem. He is well known for his exceptional accuracy and precision that allows his patients to recover quickly with minimal pain. Dr. O has conducted a clinical study on breast reconstruction at the University of Washington. He developed an ultrasonic cutting method that minimizes the operative time and tissue damage and reduces post-operative bleeding and pain, and it was published in a distinguished international journal. It is a rewarding and joyful experience to see my patients beat cancer and regain their smiles after breast reconstruction. I want to eliminate physical and psychological pain at the same time. Dr. O heals the heart with breast reconstruction surgery, while making patient health and satisfaction his #1 priority. He believes that breast reconstruction serves not only to restore one's physical appearance, but also improve one's quality of life after surgery. With this belief, he is pouring his heart and soul into his work to help patients regain their confidence.